Tell me about your result from TMS.
Yeah, so I originally came in here to treat ADHD. I was getting off of stimulants because it was causing some heart issues, and I was surprised to feel as good as I do now. Definitely alleviated the anxiety and some of the depression and symptoms of the Adderall, being on it for about 6 years, which was a very different feeling.
So you came to get Adderall because you'd been on it,
Yes.
and then you decided not to take Adderall anymore. You were having some heart issues.
Yep.
So you did TMS to see if you could maybe be without the Adderall.
Yes.
Does that make sense? Okay, so yeah, tell me more about what you learned.
Yeah, well, what I learned was I was definitely more anxious and stressed, and I would snap. My manager at work even noticed I was appearing a lot more frustrated. And once I got in the routine, into the TMS every day for a month or so, a couple months, that's when I started to feel a little lighter. I didn't need to be on a stimulant.
So then you got off the stimulant?
Yeah, I was already off it before I started treatment, but I wanted to find some other way to focus without medication. And through TMS, I slowly started seeing that calm and anxiety and depression go away, and able to. You're not going to get the same feeling as being on Adderall, of course, but it did alleviate a lot of those symptoms of the stress and overwhelm and clearing of my head, and I'm able to go to the gym every day, and I'm eating better, and socializing with friends and moving in my career because my head is clear now and things are going really well.
So you feel that getting away from the Adderall and doing the TMS, you're functioning more highly and less anxious, less depressed than when you were taking the Adderall before TMS?
Yes, I think Adderall for 6 years really took a toll on me. I'm only 28 years old and was feeling a lot of stress and overwhelm and not focusing as much as I could, and TMS definitely cleared my head. And
do you feel like you're coping better now?
Yes. Mm-hmm.
And less overwhelmed?
Yes. Less overwhelmed for sure.
And you mentioned insight. Can you talk to me a little bit about that?
I would say this was good to kind of understand how much more potential I have and how I manage my symptoms, and what I can do to better manage my attention and productivity in ways that don't require medication. Showed that I'm a lot smarter than I would think I was. I didn't need to rely on a drug to help me focus and show how smart I am. I was able to kind of clear my head and really listen to people, and my writing was a lot better.
So did you, when you were taking the Adderall, did you start to feel like, well, that's the only way I can cope?
Yes. Adderall, because after 6 years, that was the only way I was able to focus. I work remotely. That's the only way I was able to really stay attuned with what was happening in meetings, and I would just feel so down and depressed whenever I wasn't on my Adderall.
And how are you doing with meetings and remote work now?
Yeah, I'm very engaged. I'd like to, eventually go back into the office with colleagues in person, but I'm definitely able to focus and still take breaks though. With Adderall, I would forget to eat, I wouldn't sleep, and so now I'm able to take breaks and still work and have a lot more life balance. And my colleagues, like I said, have commented on how calmer I've looked.
And you feel a lot calmer?
Yes, I do, genuinely. I mean, you have to use your own tools and management methods. Still go to therapy, still keep a good routine, eat healthy, sleep well. It doesn't just stop there after TMS, but TMS does make a big difference.
Do you feel like TMS played a role in you embracing your routine?
Yes, I think going in every day, same time, same provider, and just showed me, what worked for me and what didn't, and able to kind of change my routine.
And now, I mean, for some people, especially our ADD patients, mm-hmm. they notice that after TMS, they seem to do better with routine. Like they're more into it.
Yeah, I think with ADHD, it's important to find the method that works for you. It's different for everybody, and for me, I change my routine every couple months. It's just whatever keeps my interest, and change it up, and so I don't feel the need to constantly change as quickly.
I like that. So you've got more consistency.
Yes.
Can you talk a little bit more about the Adderall and how it affected you?
Yeah, so I was on 25 milligrams extended release in addition to 10 milligrams short-term release as needed. So it was a lot. I did it right after college so I can focus in the workplace while taking Zoloft for anxiety. So probably not a good combination there. But I felt like that was the only way to get me out of bed in some mornings and stay present and focused. And my whole life wondering if I'm smart enough to be in the room because I couldn't focus and everything would take my attention, or I'd need to walk around, and the Adderall would definitely help stabilize me. But waking up at 3 a.m. and I would forget to eat, and eventually my heart started having more palpitations towards the end of the 6 years. So I needed help focusing and managing my ADHD, but I couldn't be on the stimulant medication. And I'm really glad I got off.
Do you feel like there was more anxiety when you were taking the Adderall?
Yes, but I wouldn't admit it. Yes.
I get it. And more kind of urgency, like everything seemed urgent?
Yeah, everything seemed urgent. My brain was just shooting off every 5 minutes, and I was getting things done, but at what cost?
And what caused, how was it affecting you negatively?
God, I mean, my personality too, that's all people would know me as, is I'm a project manager, so I have to be organized for a living. But it would almost be to the point where I'd be so like micromanaging things and constantly worried about details, and things would get me irritated just outside of work as well, little nuances in life, and frustration and irritability, and I would be snippy, but I couldn't help it.
Yeah.
I always thought it was just because I was an emotional person.
And what's changed? What's it like now?
Tranquil. It's quieter. It's just, I feel more mature. I'm 28, but I just feel like I grew up in a way after TMS. I'm able to get that clarity and just calm, and really I can feel it in my heart, because with Adderall, I mean, I would feel my heart all the time, which is not normal, by the way.
Yeah.
And so now it's just an organ, like we're here. I'm able to think clearly and journal things out if I have to, go to the gym, eat healthy, find other ways of coping with that stress, but not the same level.
And you feel like with the TMS, you're just overall happier?
Yeah, much happier. I don't feel the need to do it again. I hope I don't need to do it for a while. I'd be happy to come back, and the providers were amazing, and having the routine of the same day and rescheduling really worked with where I am in my life. So I'm very happy.
Well, and you may not come back for
Yeah,
years.
That's true.
Or you may never.
Mm-hmm.
And do you feel like your attention and your productivity at work is still at the level? Is it at a good level? Or did you give something up with the Adderall?
That's tough, because after 6 years, that's all I knew about being productive. I had it, so I'm 28. That was my whole professional life.
Sure.
I've been on Adderall. So I'm trying to figure out, what am I like as a professional off of it? Am I really productive? Am I actually this intelligent? And the truth of the matter is, yes. Like, I just focus just as well. I have to change my routine and my tools and how I manage focus. But yes, I would say it definitely helps me bring me where I am now.
That's great. So you didn't really give up something.
No, I don't think I did.
And you probably helped your heart a lot.
Yeah, I think it was a good move to do that now.
Okay.
Mm-hmm.
Anything else you want to say?
Don't just try it. I would say it's definitely worth trying. If you can get off the medication while doing it, even better. It's going to be really hard. It's a stimulant, and it's going to be really tough at the beginning, but I think what I'm feeling now, I would definitely recommend this to anybody with ADHD.
That's great. Thank you for sharing that.
Mm-hmm.